Hello everyone, we are Group 60. We will present on the topic Life of Healthcare for a good health and well-being for sustainable development growth with the following member.
My name is Suparvi Mima.
My name is Ratanawadi Kiti.
My name is Kanopon Tamintara.
My name is Palame Pesu.
My name is Kanyarat Ngangkul.
My name is Akini Rusi. My name is Nisana Seung.
And I, Thanawit Pitanang. Content Introduction Problem Cause of the problem Effect Improvement Rural community often have a high proportion of residents who lack health insurance, live with comorbidity or disability, and have limited access to health care facility, intensive care capability. With pensive, this resident at increased risk of COVID-19 associated morbidity and mortality. To better understand COVID-19 vaccination disparity across the urban-rural continuum, CDC analyzes country-level vaccine administration among adults aged is greater than or equal 18 years who received their first dose of either the Pfizer or Moderna COVID vaccine. Introduction Rapid urbanization, rapid improvement in standard of living, stretching natural resources and threatening environmental quality in many countries. Density has reached unprecedented level in most parts of the high, medium, and low income world. The urban population have a rate of increase, contamination of air, water, and soil. Sprawling urban areas contribute to traffic congestion, with associated air pollution, noise, and long commute time are affecting public health and productivity across the world. Problem with the recent spread of COVID-19, a pandemic that has caused a global economic shutdown and thousands of hospitalization, public health is more relevant, is critical than ever, and as a result, public health professionals are in a high demand. Public health professionals are dedicated to protecting and improving the health of people and their community. This work is realized by promoting health lifestyle, researching disease and injury prevention, and of course responding to infection diseases such as a novel coronavirus.
Public health as a problem-solving activity. Barriers to effective action. Lack of consensus on content of the public health missions. Inadequate capacity to carry out the essential public health functions of assessment, policy development, and assurance of services. Disjointed decision-making without necessary data and knowledge. Inequality in the distribution of services and the benefit of public health. Limits on effective leadership, including poor interaction among the technical and political aspects of decisions, rapid turnover of leaders, and inadequate relationship with the medical profession, organizational fragmentation or submersion, problems in relationship among the several levels of government, inadequate development of necessary knowledge across the full array of public health needs, poor public image of public health inhibiting necessary support, special problems that limit unduly the financial resources available to public health. These barriers are overcome. The community believes that it will be impossible to develop and sustain the capacity to meet current and future challenges to public health while maintaining the progress already achieved. Death and disability that could be prevented with current knowledge and technology will occur. The health problems cited in Chapter 1 and many others will continue to take an unnecessary toll, and the nation will be not prepared to meet future threats to health.
Cause of the problem in light of COVID-19 pandemics, people living across the globe have become increasingly interested in the field of public health. The pandemic represents a watershed moment for public health professionals, demonstrating just how disruptive global health issues can be at the local level. To understand the role of public health, it's important to consider the core goal of the professions as the center of disease controls and prevention. Note, public health is concerned with protecting the health of entire populations by preventing disease, promoting healthy lifestyle, and educating the public about chronic illness, comorbidity, and environmental risks. But considering the wide availability of health-related information on the Internet. Serotogenics Case Studies 1. COVID-19 epidemic crisis opened the world out for the not to let us see what problem lie hidden in the city in 2020. It merits us to see the problems of barrier, eukaryotic sluggish city administrations, the problem of inequalities within the same city is increasing day by day. Transportation, labor, and more are making city vulnerable to disease outbreak, but because we cannot stop the growth of the city, the key question is how will city of the future address this problem? Dr. Pawansom started the conversation with the case if an epidemic in the slum community in the heart of the city like Khon which hit the mind of the middle class seriously because stop at home and step of death, or even if you intend to stay at home, there is not enough space to insulate yourselves. Cities need to keep people occupied of efficient work. Therefore, people need to be close to work, such as explained. It is because of the necessity of people and this work that make the city dense, connect to each other until the epidemic spread quickly. If the problem is corrected, the change may not be the back of the hand, but it will gradually come in all. Outdated system will gradually die, new system will come, but the current law is still unclear. But it also makes the digital government a reality and possible. Natapong conclude.
Public health case study 2. At the beginning of 2017, a medical error shocked the Chinese society on Jan 26. Health and Family Planning Commission of Zhejiang Province in China released a report which said that because of the non-standard medical operation, 5 patients has got caused infection of HIV in Chinese medical hospital in Hangzhou City. Moreover, other parents who involved in this problem were also as if of the HIV infection. Medical error may be define any problem in the postcard of the medical service on vital or tender hand care action nursing form and secular healthcare action plan overcome a health problem, or it can be defined as implementation listing index on permission or temporary damage in the critical function of patent.
Access to medicine case student 3. Favipiravir is in the service shortage across the country, not enough for patient infected with COVID-19. Ready to ask the ministry to clarify why the mission of public health came out to say that favipiravir is enough and that no drug stock with the remunerated medical club has already come to tell the first time. And at that time, with elders in the country claim to say that it's not true, the medicine is enough. But that's true. If you try to ask hospital, you will find that during the past 2 months, the during favipiravir has limit use, even if it's not enough to prescribe medicine according to the guideline of the Department of Medical Service for people aged 60 years and over. It is sole service that some area can only be used by people with pneumonia. Public health faced the simulation challenge of repositioning and continue saturation success frequency lead apply. This chapter concentrates on identification of barriers most needing attention, that by setting the agenda for the recommendation to follow. Why is public health important to the well-being of both individual and community? The importance of public health and public health programs, public health research and public health policy, and public health communication.
Effect. Working at the community level promotes healthy living, helps prevent chronic diseases, and brings the greatest health benefit to the greatest number of people in need. The Centers of Disease Control and Prevention, the CDC. The CDC states that chronic diseases are among the leading cause of death and disability within the United States. Here are some of the statistics surrounding chronic disease in our country today. Half of all adults in the United States have a chronic disease. 1 in 3 Americans has high blood pressure. 2 million heart attacks and strokes occur every year. 7 in 10 deaths among Americans are caused by chronic disease. For every $1 spent on health care, 75 cents is spent on chronic disease and factors that increase their risk.
Of course, failing to uphold public health within a community can lead to a wide variety of healthcare concerns. Those chronic diseases we mentioned before, such as diabetes and heart disease, increase. When a community overall health and well-being is neglected, the CDC report that 90% of the National Annual Health Care. Expenses are for people with chronic health condition. Of reinforces the simple fact that public health professionals are critical of all country health and well-being.
3 reasons why protecting public health is more important than ever. The global outbreak of COVID-19 has propelled public health to the center of public discussion. Of course, it may seem obvious that public health would be a strong focus right now, but there are certain aspects of public health that are less discussed, yet equally as important. Given this context, here are 3 major reasons why promoting and protecting public health measures is absolutely essential. Emotional and mental well-being are vital, yet often overlooked aspects of public health. To help give patients peace of mind during this difficult time, we are now offering our telehealth solution to our health clinic. Sign up for our telehealth webinar to learn best practices and see the different ways that televisit can deliver value to patients and providers. Technology can help protect public health by keeping patients informed. Public health is all about promoting health literacy and ensuring patients play an active role in their own health care. So today's technology, such as phones, it can make us aware of news quickly. We must work together and ensure access to care for vulnerable patients population, research and understand how this disease can be most effectively treated, and finally working to develop a vaccine. We must ensure that all Americans are protected from the coronavirus. We believe that this project can be helpful to you. Thank you for your attention. If anyone has any question, please contact us. We will be pleased to answer them, and please forgive any mistakes.